In this short video, I am going to talk about lumbar fusion procedure. So what is lumbar fusion? So as the name itself indicates, lumbar fusion is when we are fusing the two vertebrae. That means there are two separate vertebrae in the lumbar spine, that is the lower part, that is the lower back, and we do a procedure wherein we put some artificial bone in between the two bones, the two vertebrae, and fix them with screws and a rod so as to stabilize that segment, so that over a period of time the bone grows from one vertebra to the other vertebra and these two are fused together. So that is what ultimately a lumbar fusion means. But why is it required? So as you can understand, it is to restore or maintain spinal stability. So these are done in cases where there is spinal instability. So what is spinal instability? When is a spinal instability caused? So it can be due to several reasons. Spinal instability can be more commonly seen in what we call as a spondylolisthesis, where the bone itself slips one above the other, and with continuous movement, this abnormal movement between the bone can result either in severe mechanical back pain, or it can result in a nerve entrapment that is there in between the two bones and can result in symptoms in the leg. So this is one of the commonest indications for doing a fusion procedure, but there are several other indications like a deformity. In the lumbar spine, deformity is more common in the older population, that is in the degenerative deformity, what we call as. So where the spine, because of degenerative processes, becomes inherently weak and it starts curving towards one side. So a lumbar fusion procedure has to be done to restore the spinal balance, to restore and make the spine straight. So this is one of the common indications for a fusion procedure in a elderly population. Of course, there are several other causes, which are slightly controversial in nature, where for example, lumbar fusion can also be done for a condition called as lumbar canal stenosis, that is just a reduction of nerve space for the nerves as due to age related processes. Most of the times this can be treated with decompression procedures alone, where a fusion is not necessary, but in some cases, due to some factors where the doctors will make a decision, a fusion procedures may become necessary in a case of long-standing lumbar canal stenosis. Of course, there are certain other more complex conditions which affect the spinal stability itself, like when the bone destruction happens due to infection, due to trauma, due to tumor, due to spinal metastasis, due to various other causes, the bone gets destroyed and the spine itself becomes inherently unstable. That is, the spine is no longer able to bear its weight. So in those cases, again, a spinal fusion procedure becomes inherently necessary, and that is one of the reasons why spinal fusion procedures can be done also. So how is it achieved? How can we do a spinal fusion procedure? So if you see a conventional, that is, even now it is done, a conventional open surgery. So where we have to make a big incision, we have to distract or retract the muscles from its attachment, and then we have to gain access to the area where that pathology is, whatever it is that we are dealing with, and then we will have to fix in screws and do a fusion procedure at that particular level. So in a conventional procedure, as you can imagine, the incision size is bigger, the muscle damage that happens is bigger, and of course, due to those two factors itself, the pain is significantly more and recovery is slightly longer than what we do nowadays. That is, what we do nowadays is a minimally invasive spine surgery. So in a minimally invasive spine surgery, where a fusion, whether it be at one level or whether it be at multiple levels in the spine, can be done effectively, the muscle damage to the spinal muscles is less. So hence the blood loss is less, the pain is less, requirement of analgesics is less, and due to which the patient recovery is faster, hospital stay is shorter, and return to work is also faster. So this minimally invasive surgery can be done in 2 or 3 different ways. So for a lumbar fusion procedure, one is we do it from the back. That is a conventional, that is a standard way of doing it, what we call as an MIS-TLIF procedure. So where we just remove a part of the bone, retract the nerves a little bit, and then go through the disc. We remove the disc and we put an artificial bone inside in order to achieve that fusion procedure and fix it with screws, all done with a percutaneous manner. Of course, this still entails some amount of damage to the nerves, and post-operatively some irritation of the nerves can all happen. So the newer techniques that are emerging, that is what we do surgery from the side of that is what we call as an OLIF procedure. So there we don't touch the nerves, we just come outside the spine, outside the muscles, we don't touch anything in the back, and then we come from the side, and then we can put a large cage inside the disc space in order to achieve the same amount of decompression that we can achieve from what we can achieve from a back. Of course, one of the more rarely we can do a procedure from the front also, what we call as an ALIF, or an anterior lumbar interbody fusion. So which also has its own indications, has its own certain advantages in given some small different conditions. So lumbar fusion procedure, as you can imagine by what I told now, can be done from all the sides. So it can be done from the back, from the side, from the front. Of course, each of these have their own indications, have their own advantages, have their own disadvantages also. So it is important to look at the pathology that we have, to look at the disease or the spinal condition that one patient has, and appropriately choose the correct procedure among these three, which is going to suit the patient the best, or which is going to give the best result for that particular patient. And these decisions have to be made by your treating doctor or a spine specialist.